How do I get better? Probably the most important question you're wondering. If you're sick, you realize that your health is the most important thing you have when you're sick because it's the one thing you want back so you can enjoy all the other things in life. So, how do I get better? That's the point of this video. How do we treat patients in the functional medicine world? This is as the last video, an unbiased, unfiltered, my opinion of how we treat our patients in our functional medicine practice at Ube Medical. This is our secret sauce, how we treat patients from start to finish. Now, this diagram that we'll go over is an A to Z template of what we expect patients to go through, but every patient is a unique individual. Every patient has a unique life. So this diagram doesn't usually go according to plan A to Z, but it's the idea of these are the building blocks of A needs to be done before B, before C, in the interest of eating the lowest hanging fruit before climbing to the top of the tree. Now, in order to really understand this video, you're going to have to watch my root causes diagram review video because I'm going to jump into this video and treatment timeline, assuming you've already seen some of these things. I may make small comments about what each one is, but the goal of this video is to talk about the treatment timeline, not the root causes. But the treatment timeline involves treating the root causes in order to feel better. So taking that root causes video, so it'll be linked in this description, go back and watch it, is to understand the root causes is to understand the eventual treatment, meaning that you got to fix the first thing before you can fix the second thing and the third thing. And it's a snowball downhill of sense of as you fix one thing, that helps you fix the next thing. And a snowball downhill is usually referred to as a bad thing, but in functional medicine, we use it as a good thing. So we are going to dive into this diagram, but please understand the root causes are tied into this diagram, and it's not going to make sense if you don't understand those root causes. So I'm going to jump in here. There's going to be some generalities, and there's a lot going on in this diagram. This will be the new patient perspective of the treatment timeline. In our practice, we also call it eating the elephant. The idea is when we see a new patient, they have an entire elephant to eat, which means lots of work to do, but they don't need to worry about that. You don't need to worry about that. Your doctor needs to worry about how they're going to feed the elephant to you. We are going to worry for our patient how we're going to feed the elephant to them. The only thing you need to know as the patient is what is the dish served in front of me. I don't need to know how I'm going to eat the whole elephant. I just need to know how I'm going to eat this dish in front of me. This is not to be mean against elephants or anything, but you get the idea that you just focus on the dish in front of you. The reason for this diagram, we told people that all the time, but the reason for this diagram is sometimes people, as they're going through functional medicine, they get lost in the fray. They're taking these supplements and they don't really understand the grand picture. This is the grand picture. This is the idea that there's more going on behind the scenes than you realize, and there's a big scope that, yes, you might be focused on gut restoration, and you only know about gut restoration because we haven't even talked about detox yet. We haven't even talked about the emotional support, the heavy metals, all of those things. So there's a grand plan going on in the background, but your job as patient is to start at the beginning, but also understand that there's more going on. This treatment timeline in this video is also directed to practitioners who watch these videos and say that if you're only doing one of these things, you're missing the boat. You've got to be treating all of these things. And if you have a niche style practice and you're treating one thing, you're really missing the boat. You're not helping your patients as much as you can. So if you don't know enough about one of these categories, you need to go take a conference, you need to watch videos, you need to learn more about each of these categories. Because if you can't treat all of these categories, then you can't properly heal all of your patients. You can only treat the ones with the problems that you can treat. Okay, so let's dive into the diagram and let's make some sense of it. So this diagram I call the treatment timeline because that's basically what it is. It's saying the timeline of events of how we're going to get you from the beginning to the end is right here, A to Z. So this is a top-down diagram, and I like to explain to everyone that really where we want everyone to be is all the way down here at the bottom where it says optimal wellness. That's where you feel amazing and you're just sailing into the sunset. You know what supplements you're on and you know what feels good, and everything above this section is fixed and you just feel amazing. That takes a while to get to. You notice there's some times off to the side. These are just relative times if things go according to plan, which it doesn't always go according to plan. So it takes a while. But in the optimal wellness, you're doing things like you're focused on your health span, not just your lifespan. The idea there is that lifespan is just how many years you're on this planet. Health span is how many amazing years you have on this planet. You're focused on anti-aging and hormones and genetics and stem cells and all that. You're also doing infusions like NAD plus and methylene blue and ozone and my health span IV protocol. You're doing longevity peptides like CJC and maybe semaglutide to control your weight. You're doing things like telomere tests to see how your health, and your CNS vital signs to see how your dementia risk is, micronutrient tests, genetics, all that. But that's not where everyone starts, and I really shouldn't have paid that much attention to it, but that's where we're trying to get to. That's not where you're starting. You're starting as a new patient way up at the top. This first line that says first visit, this first line is where we're starting. Now you'll notice there's categories at the top. So what category are we treating? What plan are we doing? How long is it going to take? What are the infusions that go along with that treatment and problem? What are the peptides and other services that might go along with that? And then what are the testing that correlates with that? So that's how this diagram is set up in these columns top down, but also in a treatment timeline if you're going to finish A before you B, C, D, all the way down the diagram. So we're going to start at the top, which I mentioned optimal wellness just to know that's where everyone's going, but everyone starts at the top. So everyone starts with their first visit, whether that be in a YouTube video, whether that be in a doctor's office, everyone starts with their first visit. And notice the first things you do are not fancy functional medicine supplements and things. What are the first things you do? Lifestyle changes. That is the lowest hanging fruit. Before you do anything, you do the easy stuff like sleep. Make sure you sleep enough hours. Make sure you drink enough water. Make sure you're taking out the inflammatory foods from your nutrition. Make sure you're eating nutritious food, because you can do all kinds of fancy functional medicine stuff, but if you're not sleeping enough, if you're not hydrating, you're not eating the right foods, nothing's going to go right. You've got to fix the foods and all the basics before you do that. Next on the list is cleaning up the environment. So we say you got to stop the retox before you can detox. One of the metaphors I frequently like to use is, if you're drinking a cup of gasoline every day, you're probably going to feel pretty bad. So should I be adding supplements to try and detoxify the cup of gasoline you're drinking? That would make lots of money for me. That'd be great. I'd have a forever patient because you never go anywhere because you're always sick, just modifying the sick with the supplements. Or should I tell you to stop drinking the gasoline? So before you start taking a bunch of functional medicine supplements and all this fancy testing and stuff, just do the simple stuff. Eat, sleep, drink clean water, clean your environment. And so cleaning your environment is multiple things. It's air, food, water, products. Those are broad categories, but air, food, water, products. Products is like shampoos and soaps and things. Everybody knows what water and food are. But number one is air. It's the most frequently, and I'm pausing, it's the most frequently missed thing in our patient population. The number one reason you've seen 10 doctors and not gotten any answers is probably because something is in your air and you can't smell it, you don't know it's there, and the answer is mold. Mold is one of the most common things. It's great for business for me because so many people are missing it. Conventional doctors aren't talking about it, and so many people don't even know how to treat it. Look at your home, look at the air. We require all of our patients to do an ERMI test, E-R-M-I test on their home. It is the single greatest test that you can do to evaluate what the air quality is in your home. Is there too much mold? Is my home clean enough to heal in, etc.? It is not a perfect test. This video will not go into the details of ERMI, but look up ERMI and do a test on your home if you're not sure if you're living in mold. Do not pass go if you have not proven that your home is free of mold. I don't care if you think it's free of mold. You need to prove that it's free of mold. That's all I'm going to say about that. Next on this top line as we go over is infusions. All patients normally need detox infusions by the time they come to our practice. And so my detox protocol is called IV lipid exchange. Lipid exchange is the human detoxification process that we already do. So doing the IV version is just hijacking the human detox processes and speeding them up in the most aggressive, powerful way. You also start with testing. Cleveland Heart Lab, CHL, is the lab we usually use. The initial panel is just the beginning panel that we do on all of our patients. And then the GIFX is the stool study that we ask everyone to do. Every patient that comes in does a stool study. Every now and then we have a reluctant one that refuses, but still willing to go through the treatment. But gut is the most important. If you watch my root causes video, you know gut is the most important thing. Everyone's gut, by the time they come to a functional medicine office, is always broken. We all grew up in the Pop-Tart pizza antibiotic generation, and we've all broken our guts over time. No one's is good enough. Now, I can say that because I haven't met anyone that's got a perfect gut before seeing functional medicine practice, but maybe you're the first. But then I don't know why you're watching this if you have a perfect gut. Other things that you can do to facilitate your healing is, of course, peptides. BBC 157 is a peptide that helps healing, anti-inflammation, regenerative, very powerful peptide. So we frequently do these things in our first visits to help people feel better while we're working on those root causes. And then you see HBOT right below that, which is not a peptide. I just didn't want to create another category. So HBOT stands for hyperbaric oxygen therapy. So getting oxygen therapy is a great way to heal the human body and stimulate regeneration and stuff. Okay, my IV lipid exchange protocol IV is very powerful, but don't discount some typical Myers and glutathione infusions. If a Myers and glutathione infusion center is near you, those are great, powerful infusions all by itself. Not nearly as powerful as the lipid exchange, but if that's all you got, that's still great. Okay, so remember, we're looking at this whole treatment timeline, top to bottom. I just went through the first line really quickly, really briefly, of what we expect all of our first patients to do. That's what, if you come to see us, those are the first things we're going to be doing. We're going to be asking about sleep. We're going to be asking about hydration. We're going to be asking about food and telling you about food. We're going to be making sure your home is clean. We're going to start you on peptides, infusions if financially you're able. We're going to be doing some testing. That's the first step. One of the problems I see with some of my functional medicine colleagues, you'll see this whole testing column down the side of the diagram. One of my issues I have with other functional medicine practitioners is they throw the kitchen sink of testing out at patients, and then they get all this lab testing back, which costs a fortune, and then they say, oh, based on these deficiencies, you're going to be on these supplements, and then I'll see you in 6 months because you're just going to be on those supplements until we retest. No. The point of functional medicine is to identify the root causes, fix those root causes so that they fix downstream things. For example, if your zinc is low on your lab work, which is common, we see people with low zinc all the time. Yes, we replace that zinc because that's low-hanging fruit. You can feel better when you replace the zinc and iron and all that. But that's not the problem. The problem is that humans are low in zinc because A, they're either not absorbing it, they're not digesting it, or maybe they're not even eating it. So in the functional medicine world, we shouldn't just be giving people zinc and saying, see you later. We should be giving people zinc and saying, let's figure out the reason why you didn't have zinc in the first place. And if you can fix that reason, then you don't need the zinc the rest of your life. The goal in functional medicine is to get off of all supplements and only on whole, real food. Now, unfortunately, in America and other countries, our food is not as diverse and nutritious as we need it to be. So, in general, a lot of us, including myself, are on long-term supplements. But that is the goal, to have the least amount of supplements possible and still feel amazing. Okay, so now that we've done that first visit, this first visit will be a few weeks of healing. We'll be putting you on gut restoration. You can see gut restoration is right under that. We'll be starting some of the gut restoration supplements because even though we don't have your stool study results yet, your microbiome's broken. We know it. We're just waiting for the results to prove it. So we're going to go ahead and start those gut healing supplements ahead of time. The stool study is going to take 4 weeks. So we're going to start those supplements right now to see how your body reacts, how you react. And that way we can get the healing process started so that by the time we get the stool study in, we can add the next layer of treatment, et cetera, et cetera. This is a process that takes time. So the sooner we start it, the sooner you get finished. Then you start, so let's zoom in a bit. So now we're done with the first visits. You've changed your nutrition, you've been on the healing supplements, and now we're really going to dig into the gut restoration. Now, there's a lot boiled into this diagram that at the surface level you won't understand, and I'm not going to go into detail in this whole video, but the idea is to get an overview of this treatment timeline. So we do our gut treatments in what we call gut restoration rounds, or Biocidin rounds for short. Biocidin is one of the most common products we use. It is the kind of cornerstone of those treatment programs. If you don't know what that is, look it up. Great product. It's on our store and everything. So we treat the gut in these rounds, and this is not really how the Biocidin supplement treats guts. This is how we treat guts in our practice, is we do 4 to 8 weeks of this healing, and that's what you see. So there's 4 weeks of changing the nutrition. Then right below that, you see phase 1 is 4 more weeks of healing. So basically, every patient that comes in gets 4 to 8 weeks of healing supplements, supporting, rebuilding that microbiome before we go eradicating things. Too many of my colleagues, too many people in functional medicine are just focused on eradication. Guys, conventional medicine has been focused on the germ theory and eradication, and it's not working. America's getting sicker. People are getting sicker. Less focus on eradication and more focus on rebuilding. You focus on rebuilding the good guys, and then the good guys want to push the bad guys out. Now, obviously, we're talking simplicity, good guys versus bad guys, but that's the basics of it. Focus on rebuilding the good guys, so that way when you try to eradicate the bad guys, A, it's easier, B, you have someone to take over. If you just focus on eradicating bad guys but never replacing the good guys, then the bad guys just come back. So focusing on that healing for 4 to 8 weeks before you do the eradication of Biocidin, and then before you add in the biofilm disruption right below that for 4 weeks. And then after we do a good 6 weeks of this eradication, then we take a 2 to 4 week break before we do it again. And that's what you see round 2 there, where we use amphotericin in the next eradication, and then we take a break, and then we jump into round 3 with itraconazole. These are some of the treatment protocols, ideas that we use in our practice, and I'm making a mess of the diagram, but that's the idea, is to go through these treatment protocols as we're fixing the gut. This is meant to be top-down diagram, but it gets customized for each person. So some people divert after round 1, most people divert after round 2 into detox before going back and forth between gut and detox. But the idea is, our promise that we make to all patients that come to see us is that by the time you're finishing round 2 of this diagram, so that line I just drew in the sand, by the time you're breaking line 2, you're finishing line 2 of the treatment, or round 2 of our treatment plan, our promise to you is that you are 50% better than when you started to see us, when you came in to see us the first time. Now, that's a bold claim, and it's a claim I stand by, and the idea is that most of our patients, by the time they cross that line, they're 80 to 90% better. We hold ourselves to 50% better, but most patients will say they're 80, 90% better, but they want to keep going. They want to get to the 100%. They want to get rid of the cancer risks, the dementia risks, the heart attack risks that are still lingering in the background, even though they feel 80, 90% better. Now, there's an asterisk there. I've talked about it in root causes, is the root causes video. If you get your leg bitten off by a shark, we're not going to regenerate that. Let's be real. The other thing is the 50% improved marker is to say that you were overall 50% better. So a lot of times the way that works is your brain fog is 100% better, but your joint pain is 0% better. So sometimes humans, many times, most times, humans don't heal linearly. It's not just like brain fog gets 10% better, then 20% better, then 30% better, and joint pain 10, 20, 30. We develop our symptoms and diseases irregularly, and we reverse them irregularly. It's also to say that very debilitating diseases like ALS and cancer and things, you may feel better, you may have less rashes, you may have more energy, you may have less brain fog, but your ALS is still progressing until we can finally reverse it. Your cancer is still progressing until it's reversed. So that's kind of the caveat with the more severe diagnosis like that, just to use those two for example. So the idea is, as you finish that second round of Biocidin, our promise to you is that you're 50% better. The number one reason that our patients are not 50% better when they cross that line is always because they did not test for their home for mold, and there's more than they realized. Sure, it's not a black mold, burn the house down, but it's enough mold that they can't heal. They're not progressing because they never check their home for mold. So now it's a requirement for all of our patients. Before they start round 1, they will have had tested and proved that their home is at least safe enough to heal in. If not, we can't progress any further. It's a waste of their time. It's a waste of their resources. So I'm going to tell the same to you. You'll see there's other gut rounds that we always take our patients through, the Biocidin with itraconazole and our high-dose SAC-B treatment plan, which is Saccharomyces boulardii. And those are all treatment plans to restore the gut. This diagram is not for everyone. I've done 8 and 9 and 10 rounds of Biocidin because I've had mold exposures and other issues that have restarted my gut function. I've had to do it again, and I feel good, and I like to keep feeling good. So this is not just a cookie cutter, you do 1, 2, 3, and then you're done. This is a customized, as people go through the protocols, you listen to your body, you listen to how your body responds to the protocols, and then you may end up doing the one that worked the best for you again, where someone else might sail right through that one. So this is a customized diagram, not one size fits all. So as you're kind of finishing the gut work, we usually, after the second round of Biocidin, we start diverting into detox work. And I've learned that that's beneficial for 2 reasons. One is people get tired of doing gut work. They're just doing gut work, and they feel like we're a one-trick pony, and they get kind of bored, so they don't like it. So we start switching to detox. The second reason is the gut likes breaks. It likes to heal and regenerate and take some time. So switching to detox buys the gut some time to continue healing so that it can get attacked again, but more effective in the future. Also, a lot of times when people switch to detox, after 4 or 6 months of detox, they start realizing that their gut is not all the way fixed, and then they start asking us to do their next gut treatment. So that always feels good when the patient knows intuitively what they need. The next step after you're done doing some detox work is start doing the detox work. Now, detox is one of my pet peeves. Doctors and practitioners too frequently put people on detox protocols and really don't know what they're doing. If you do not understand the lipid exchange protocol, I highly encourage any practitioner, any patient to look up the lipid exchange protocol on how the human body detoxifies. I don't like it when doctors just give silymarin, which is milk thistle, and some B vitamins and glutathione and say, oh, you're detoxing. That's not enough. It takes more work. And I need to do more videos on detox, so I'll hopefully put some more stuff out there. But basically, we call that lipid exchange. That's a human detox process. Now, there's 2 major categories of toxins that humans need to detoxify. One is these three right here, the biological, mycotoxins, and chemicals. Those are, if you watch the root cause diagram, there's more information, but biological toxins are things that grow in us and on us. They release biological toxins, we absorb them. Number two is mycotoxins, that's mold toxins that may grow in the walls and home, and you breathe it in and you absorb it. Chemicals are man-made chemicals, plastics, gasolines, fertilizer, all that jazz that's in our bodies. All of those toxins and chemicals come out through a process called lipid exchange, your own human detox pathways. Okay? That's pretty simple. As long as you're supporting your detox pathways, your body will decide the toxins and chemicals that it wants to get rid of and can get rid of. But the other major version of toxins is called heavy metals. Heavy metals do not get detoxified. So they're in my detox section, but I always like to make sure that's a clear message that's sent. You do not detox heavy metals. Sure, in the grand sense of the word, we say we detox metals. I say it too, even though it's not entirely true. The main point I'm trying to drive home now is that heavy metals are not detoxified. They're chelated. This is important because humans don't naturally have a great chelation process. We don't. We are metal collectors. We are not metal eliminators. You know what metals you collect? Iron and zinc and selenium and manganese, molybdenum, all of those metals and minerals we want to collect. The body's not used to being exposed to lead and mercury and arsenic and cadmium. It was never supposed to be exposed to those, so it doesn't really know what to do with them. There's not a good process. Now, I'm not saying we don't eliminate metals at all, but I am saying compared to the chelation process that we can do, our bodies are terrible. If I had to give an estimate, I'd say we're 0.1% good at removing metals compared to what the drugs and chemicals do. And that is a specific comment. Chelation is done with drugs. They are man-made chemicals. They are not natural. I am not a believer that cilantro and all that will chelate your body. Glutathione will not chelate your body. Yes, it does, but small percentages. When you have too many metals in your body, you just need the chelating drugs in order to pull those out of your body. Okay? So in this detox process, everyone always needs lipid exchange because we all have too many gasolines and chemicals and stuff inside us. But not everyone needs heavy metal testing. Not everyone needs heavy metal chelation. Everyone needs heavy metal testing because there's no direct symptom of mercury. Oh, you have this symptom, that means you have mercury. Or, oh, that symptom means you have lead. They're very sneaky. They're very ambiguous. So we get all of our patients to a heavy metal challenge to see, do they have too many metals? And if so, then they need chelation. If not, they don't need chelation. Another pet peeve I've seen in the functional medicine world is practitioners that are just chelating patients, telling them that they have metals and that they need chelation and telling them they need 30 or 40 infusions or something like that. If you've never done the test, you don't know how many infusions you need and you might not need any. You've got to do the test in order to see if you need any chelation. But everyone needs lipid exchange. So we do the heavy metal challenge, and then we do lipid exchange. And after a good 4 or 6 months of lipid exchange and detox, yes, it takes a while, then we start doing some of the other testing. Now, I won't get too specific on what test your practitioner should do. There's some options there, the NutrIval, the OAT, the Mycotox, the Tox Detect, and glyphosate. We do a lot of NutrIvals because it's a good combo of gut markers and toxin markers and heavy metal markers and nutrient markers and mitochondrial markers. So we do a lot of that testing, but each one is customized to the patient. So usually we do 4 to 6 months of detox before we ever do the test. You know why? Because everyone needs at least 4 to 6 months of detox. Then we do the test to see how much is left over, and commonly people need more, especially by the time patients come to see us. So repeating your chelation test as you're going along to see how much more you have to go, see if you're done. And this is the process that we kind of go back and forth between gut work and detox work in order to get patients to, as you see over here, at least 90% improved. Now, I told you before that most of our patients are 80-90% improved, even up here at the 50% improved. But by the time you finish detoxing someone, removing their metals, and restoring their gut, almost everyone feels 100% better for the most part. Now, life still happens, so things happen. They may not be perfect, but that's the idea, feel mostly better. What's interesting is below that is where we get into more the atypical things that is important for life, but not necessarily important for the physical health. But we are a mind, body, spirit, not just a physical body. So as a functional medicine doctor and MD, I'm more focused on the physical body, but I absolutely know how important the mental body, the spiritual body is. And so we do some work here, but this is more important for therapists and spiritual leaders and things to do. But this emotional brick cannot be missed. It cannot be missed. honest. We all are emotional creatures. Men, I know we don't like to admit that we're tough and we don't have emotions, but no, we are all emotional creatures. And if you've never spent time processing that, you still need to. In the root causes diagram video, I talked about all the toxins, the biological, the metals, the chemicals, and what was one of the last ones? Emotional toxins. So we've all been hurt. This is a real life. There's always been hurts. Everyone I know that by the time you've reached adulthood, you've had some hurts, and in adulthood, you've had even more hurts, some big, some small, but we've all had hurts. And the biggest hurt for you is the biggest hurt for you. Sure, it may not be a capital trauma word, but it might be a lowercase trauma word. But for you, that was the biggest trauma you had. So that's important for you to emotionally detoxify. How do you emotionally detoxify? There's multiple ways. So, of course, a therapist can help you. So here's the problems over here, right? Trauma, self-doubt, sick identity. Sick identity is the thing where you've been sick for so long, you don't know how to be well. And that's kind of a trick your mind is playing on you. And you got to do the work to say, no, I am well. Physically, I'm doing better. My markers are better. And now I need to convince my mind that I am well and I can be well, all those things. And then, of course, there's faith-based and spiritual. And that's some of these things are a lifetime, not just 3 months. So therapy, limbic system prescriptions like EMDR, gosh, I'm blanking on the Annie Hopper program, DNRS, and Primal Trust, all the kind of programs you can do to start resetting your mental capacity. And then, of course, microdosing using psychedelics like ketamine to help change the brain, neuroplasticity, make the brain more malleable and ready for healing, so that as you put those healing things in, it happens faster. I'm going to do more videos on ketamine and psychedelics in general. You can also do testing like the Dutch Plus to look at adrenal levels, cortisol levels, those kinds of things. So once again, this is the overview version. There's a whole lot more that goes into that emotional brick, but that's the key piece. After that comes the atypical needs. Now, I catch a lot of flack over this. Some of my patients coming to see me who have seen other practitioners on videos and stuff have a lot of problem with this. But I stand firm, in my opinion, on Lyme treatment and EBV treatment, because it's worked for my patients, and I have not had anyone that I need to rearrange this diagram for yet. Not saying it won't happen, but currently Lyme and Epstein-Barr are at the bottom of my diagram. The reason why it's at the bottom of the diagram, because I want to make sure you and my patients know that I know about it, I know how to treat it, but I don't need to treat it. We don't need to treat it. Because the truth is, as I mentioned in the root causes diagram, if you treat the gut, if you detox the body, the immune system comes back online and it will fix Lyme for you. It will fix EBV for you. Now, that doesn't count acute Lyme, and some patients may need acute Lyme treatment earlier, but as it stands now, chronic Lyme patients in my practice, never need Lyme treatment first. They need gut treatment, they need nutritional work, they need detox, and the Lyme fixes itself. And I've got case studies to prove that that's working. So the reason why it's atypical needs all the way down here at the bottom is because if you're not feeling 100% better by the time you get to this section, it means you do have an atypical need. We do need to specifically treat the Lyme. We do need to specifically treat the EBV, co-infections, MARCoNS. We need to do a further dive into EMFs and things, and there's other atypical things. But notice this section just says specific and condition focused, meaning if you do have a Lyme issue, well, that's a separate specific condition. EBV, well, maybe you need to do vitamin C infusions or something. That's what you see over here, high dose vitamin C infusions. Lyme, maybe you need to do some ozone infusions. Maybe you need to do some different peptides like thymosin alpha, thymosin beta. And then, of course, the specialized testing. So if you are concerned about Lyme, if your doctor's concerned about Lyme, you got to do the Lyme test. EBV, you got to do the EBV test. So anyway, that section is important, but honestly, by the time someone's been my patient for 2.5, 3 years, that's not an issue anymore. We're doing the test more to prove that it is fixed and not a problem than we are doing the test to see if it is a problem. And then last but not least, by the time you pass all of those tests, you're then down here in this optimal wellness test where we're doing routine lab checks to see where you're at. We're also checking your longevity markers like telomere testing and whatever else might come out in the future to make sure that we can keep you as healthy as possible and not get any surprises. Doing things like the Prenuvo or Ezra MRI scans to make sure we're not missing any early tumors, the Gallery test to look for early cancer signs. I feel like there's another one that's not coming to mind. But anyway, CNS vital signs, dementia testing, micronutrient testing, and the genetic testing, doing IV infusions and peptides and things to keep you optimal and fight the aging process, because we're all aging. So as men, we might need to be on some testosterone boosting as we age, and women, you're going to need to be on hormone replacement as you age, all of those things. And the goal of this process is to learn your body By the time you've gotten to the bottom of this diagram, you know your body, your weaknesses, your unique individualities, and those are the things you're going to treat. Those are the things you're going to focus on in your repeat testing. And if your doctor's not helping you do those things, you need to find a new doctor. These are, of course, all the things we do at our practice, so we would love for you to call us and come to see us. This is the grand overview of how we treat all of our patients. We live and breathe by this diagram. We customize this diagram as you're going through to kind of show you when you're in the mall, you are here. So as we're treating a patient, we'll go back to this diagram and say, okay, you've here, we can even draw it. You've finished BioSign in round 1. You're now in round 2, and you're specifically in this phase 2 right here. You are here. You've got more work to do, but you're making progress. Here's that goal line of when you pass there, you're going to be at least 50% better, so keep holding on. And so as a practitioner, I encourage other practitioners to do the same thing, come up with a diagram to help patients get through their treatment program and realize that in functional medicine, it's not take this pill and feel better. It's you might take this pill, you might feel a little worse in the short term, and then you will feel better. But there's a method to the madness. There's a plan in the background. Grab the lowest hanging fruit before you start climbing the tree to get the highest hanging fruit. Do not detoxify before you fix the gut. Anyway, I could ramble on and on. There's a million more things I want to tell you about this, but that's the simplest version of the treatment timeline overview that I could give you. I hope this helps you. Bring this to your doctor if you're not sure. Let them learn from this. Let them use this to treat you. I hope this helps. Bye, guys.